This is a completely cosmetic bikini line sleeve gastrectomy. This is a patient who had requested cosmetic incisions for a sleeve gastrectomy. The patient previously had an abdominoplasty, so had waistline incisions, which I was happy to attempt to use. This is me taking the greater curve vessels in preparation for the sleeve gastrectomy, starting distally and then working my way proximally on the stomach. With regards to the incisions, what I like to do from my bikini line incisions, whether it's a gallbladder or a sleeve gastrectomy, is put the camera port, hide it in an umbilical or belly button incision, and then the three remaining trocars go into that waistline or fan and steel or abdominoplasty incision, so we're just using old scars. I also use a liver retractor for this. I haven't really moved on to the liver hammock stitch. As you can see here, this is the stapling of the stomach. And for this patient, I made a tiny incision for the liver retractor within the patient's tattoo. That was also essentially hidden by the tattoo as well. So this is the stapling device. We have the bougie in to the left of the stapler. That gives exact size measurement of the sleeve gastrectomy. Just working my way up along the bougie for a perfectly standardized size of sleeve gastrectomy using a 36 French bougie. You can see in the top right corner here, getting the fundus out of the way, so all of that extra stomach in the top is removed as part of the specimen. Using the robotic stapler, which is able to clamp and determine tissue thickness and appropriate staple height decision making as well. And just waiting for compression, and there's the staple, and here's the final staple fire here. And the sleeve stomach is going to be on the left, and the gastrectomy, the specimen that is removed, is here on the right. So that's this part that's removed on the right, and the sleeve that gets left behind on the left. And then I also like to perform leak testing. The VisiG bougie is injected with a solution of ICG with green dye, and under special firefly mode, we're looking for any evidence of green dye, which there is not in this case, which means the staple line is nice and secure and intact using the sensitive mode there. Very happy with how this looks. So then I'll suction out all of that. And then I like to perform a hemostatic agent application to the staple line to help with hemostasis. And then while that glue is fresh, also pexy the omentum on top of it as well for an extra layer of security. So this is a completely cosmetic bikini line sleeve gastrectomy. You can see these pictures here. Almost none of the incisions are visible. Thanks so much, and subscribe for more videos.